just had Botox, maybe your first time or you're a regular Botox user, we call it Eradamus because it erases away the fine lines and wrinkles. So in terms of the aftercare, if you've had it done in these areas over here, what we always warn you before we inject you is we assess your anatomy. We're looking at the frontalis muscle, we're looking at the orbicularis oculi muscle, the round muscle, the nasalis muscle. No one wants those fine lines here. We're also looking at the frown. So we're looking at what muscle is the strongest first. So then we're going to put baby units everywhere else. So if your frown is strong, if I just paralyze this, let's get stronger. So what we want to do is we want to put baby units everywhere else. So remember when people smile and they have all those fine lines there, but they're completely clean here? That's badly injected Botox. Or they have fine lines here. That's because they've forgotten about this muscle, the round muscle. They've only done this long fiber here. They've forgotten the muscle is round. So you're supposed to come and inject here. So your Botox will kick in within 4 to 7 days. You will still move. I think I've just done my Botox a week ago. You will still move, okay? No one's gonna do this to you and no one's gonna do this to you. However, if you have a very strong frontalis muscle, so you have lines, radiator lines all across when you talk, okay? If it's extremely strong, we are only allowed to inject in the upper 2/3 because if we inject in the lower 2/3, you have a very high risk of brow dropping. And no one wants their brows to drop, not even men. So you don't want that look. So we've got to stay up here. So that means there may be a little bit of a line left behind. You're better off having a little bit of a line with some natural movement than being completely paralyzed like this. There's nothing natural about that. The other thing is, it's a needle. There's always a risk of bruising. Again, it's going to go away in 3 to 5 days. If there's a bruise, we'll break it and we'll tell you there's a bruise and we'll turn it yellow very quickly and we'll give you some medical anti-bruising cream to stop it and to make it go away. Ice the area. The myth about Botox is I can't lie down afterwards. No. Botox is injected in muscle. If it's injected anatomically correct, then you're fine. You can do whatever you want, but you can't go to train in the gym. You can't go to the sauna for 48 hours, and that's it. But you can go to sleep and you can lie down. Other areas we use Botox for is to shrink the teeth grinding if you've got that painful problem here, is to stop the tip from nasal flare, to stop the tip moving down or your nostrils to be too large. The one thing I would say about Botox is do not use it to raise your eyebrows. Never tell your doctor I want to raise your eyebrows. This is the wrong thing to do. You want to use Forma, which is a dermal filler. You want to use hyaluronic acid to raise the brow, not Botox, because if you keep paralyzing that muscle, eventually it will drop even more. So the aftercare for Botox is just don't work out and don't go to the sauna for 48 hours. Other than that, the bruise will go. Any questions you have, any concerns you have, always contact the LMS concierge team or contact your aesthetic lead and we can answer them for you.